East African Ramgarhia Board is a religious and social institution. We were formed way back in the 1935. We have grown leaps and bounds. We are in fact one of the largest Sikh religious temple organization in Africa. We represent a large part of the Sikh community in Nairobi, and we have our Gurdwara Sahib, which is in English a temple in Pangani in Nairobi, where we hold all religious functions of the Sikh community, and also social functions like weddings or other celebrations are also held here at the Gurdwara Sahib in Pangani. One of the highlights which I would like to mention is that during the COVID pandemic, which hit us early 2020 and went through right to, I would say, middle of 2022. During this period, East African Ramgarhia Board and Ramgarhia Youth Association started a program of distributing dry foods to the needy, because people could not get jobs, they could not put food on the table. So we, with our youth organizations and support from the entire community, a lot of corporates supported this program, a lot of people from our community supported this program, and we are very proud to say that we have served the community. And just to give an idea of the scale to which the service was done, we have distributed over 900 tons of dry food materials to the community, which equates to close to 11 million meals. In addition to that, we have a very unique truck which has been custom built. It's called the Guru Nanak Langar truck, where we cook here in the temple and we serve hot cooked meals to the needy people in the community in the vicinity of Nairobi. We provide healthcare through another affiliated body of ours, which is called the Guru Nanak Ramgarhia Sikh Hospital, which is just across the road from the temple in Pangani along Muranga Road. And again, that institution has been there for the last 40 years. Almost 40 years. Before that, we used to run a small clinic. Then it became a nursing home up to, I think we are a level 4, a tier 4 or level 4 hospital now. And I'm very happy to say that the hospital is a fully accredited NHIF healthcare facility. We have a lot of people who come there for their healthcare, including people from the Teacher Service Commission, the Kenya Police. A lot of insurance companies have Guru Nanak as their designated medical facility, and we are very proud because of our religious background. It is the only hospital in this country which is a fully vegetarian hospital. Because of our religious beliefs, we do not serve any non-veg food there. It's a, once again I repeat, it's a fully vegetarian facility. Whenever there is any calamity along Thika Road, Guru Nanak Hospital is the first point of medical care. And we don't look at who has come in and how has he come in and what is he putting on the table. We give them the health care that is required. And after the health care is given, then we see what is to be done next. Whether we are not able to handle the injuries, then the patients are transferred to other medical facilities. In the board, within the committee, we have no wrangles. The only issue that is there is a delayed annual general meeting. Now, as you have reported and as is known, we were elected into office in June 2018. And immediately in 2019-2020, we had the COVID pandemic. Our committee has been committed to one which has been lacking over the years, is presenting audited accounts to the membership in good time. I'm not saying audited accounts were not presented previously, but audited accounts to be presented to the membership in good time. And this is what we really tried, and there have been some delays, and some we have to take blame. Yes, I cannot say that we are 100% right. On the other hand, there were several factors that caused these delays. And we did hold a AGM, which is called a mid-term AGM in November 2020, where all the reports were presented. All the accounts up to 2017 were presented to the membership and approved. And now our intention is to bring all our backlog of accounts up to date. And there has been a delay in that. COVID is one of the reasons, because during COVID we were not allowed to hold religious gatherings. Even gatherings were not allowed, not only in temples, but even in social places or even in hospitality. So because of that, 2020 was COVID, 2021, bulk of it was COVID. It's only in 2022 things eased up. And we had written to the registrar of societies explaining our position, and we were given up to March 2023 to hold our AGM. And we had announced our AGM to be held on March 26th, 2023. However, one of the key points which we really want to do is to present the audited accounts to the membership. There has been a delay, and we then requested for some time, and we were given up to 30th of June 2023. So the AGM, which was slotted for 26 March, was postponed on the strength of the information or the dispensation we got from the registrar. However, some of our members were disgruntled, if I may say, and they went to the registrar, and we were told, no, we have to hold the AGM on 26 March. Which then we wrote back saying that it's not possible, that we should be given extra time. And during this to and fro between us, the disgruntled members, and the registrar, there has been conflicting information coming from the registrar's office. And we were then given directions that there is no question, we have to hold the AGM on 26th, and it was not possible to do it. So we then made an application to the High Court for a stay order to the AGM of 26th March, which by the grace of God, the court granted that order. Therefore, the AGM did not take place on 26th of March 2023. Having said that, another letter was written from the registrar's office, which is being used in the malicious stories that have been published in the media, saying that we are illegally in office, which is a direct contradiction to what was written earlier on. And already the matter is in court, and it's not for me to say, it is for every learned person to know that when a matter is in court, then you don't contradict it by writing letters, which in legal terms is what they call contempt of court. We have now already announced that we are going to have an AGM on the 21st of May. Preparations are already in hand. Very soon, within the next few days, the notices are going to be out, and our prayer to our Almighty God is to give us all the strength that we hold a peaceful election, and that a new team, it's an election AGM, that we hold a peaceful annual general meeting, and that the membership will exercise their right and put into office members or officers of their choice. We are at an advanced stage with our auditors, and we have already received the final draft. As I'm talking to you now, they are going to be reviewed, and we are going to have our meeting of what we call the Governing Council, and the Governing Council will approve the accounts up to 2021. 2022, the audit is actually ongoing as we talk. All the information is with the auditors. Our auditors are PKF, and so we are very, very confident. In fact, there is no question. We are going to present up to 2021 accounts to the membership at the AGM, which is going to be held on May 21st, 2023. A simple visit to Guru Nanak Ramgarhia Sikh Hospital will show anybody what is happening there. The hospital has gone through a tough time, like every hospital in the city. During COVID, because we were not a COVID center for medical care, our business at the hospital went down 35–40%.
Yeah, something.
35 to 40% it went down, and obviously a huge reduction in your business to that level will cause some strain on your cash flow. However, we had resources through which we have managed those difficulties, and by the grace of God, I don't know if you know what is Guru Nanak. Guru Nanak is the founder of the Sikh religion. So the hospital is very close not only to the members of East African Ramgarhia Board, to the entire Sikh community. And the entire community is hurt today that such allegations are being made, and without any justification at all. I'm repeating, a simple visit to the premises, to the hospital, will speak for itself. The hospital is serving the 180, and we have a footfall of not less than 500 to 1,000 people. You go there and you'll be surprised how busy the hospital is. It wouldn't be the case if it was on its deathbed. Again, there are allegations that there are court cases, that the hospital is being taken to auctioneers and things like that. There is nothing like that. Today, the way the judiciary operates is very transparent. You can go on Google, go to the judiciary website and check for yourself that how many cases is Guru Nanak facing at the moment. How many judgments have been given or decrees have been issued where auctioneers are sitting out there waiting to auction the hospital and its items. As we talk today, there was one, yes, and it was resolved. It was sorted out, it was paid. And this can happen to any institution or any business. We are not exempt from what happens around. The one which hurt us most is salaries. I will tell you that salaries have been paid, but anyone can go and check for himself and ask independently. Anyone working there. We have close to 190 people employed at the hospital, plus doctors, plus consultant doctors. And you can go and ask the direct employed employees, have you been paid your salaries? And you will know for yourself. As far as I'm concerned, I know that every month before the end month date, all salaries are paid.
Besides what our General Secretary has said, we are very transparent, we are very clear. Nothing has happened at the hospital. All payments, salaries have been up to date. Suppliers have been up to date. Doctors have been up to date. And a lot of people do come here and appreciate our hospital. If we walk even now, it's very clean hospital, renovated, fully renovated. We are still in the process of doing other renovations at the hospital. This is from the recurrent account from the hospital. With God's will, this hospital will move to the next level in a year or so. We have upgraded all our system into the ice system. Our new system are there, and it is really moving quite fast. And we have got new in-house consultants now, in-house surgeons we are employed at the hospital. We as a committee, when it came in 2018, myself and my committee of 22 members in the Governing Council, I can assure that not even a single shilling has gone haywire. We have got a count of each and every shilling at the hospital and at our temple, Gurdwara. Not a shilling has been gone haywire. All accounts are there, you can verify.
I will urge members of the public to ignore the malicious and defamatory statements that were published in the print and electronic media about the East Africa Ramgarhia Board and the Guru Nanak Sikh Hospital. These malicious facts are being peddled by one disgruntled member who wants to be General Secretary by all means. And the procedure for election is there, let him follow it. It doesn't help to spoil the name of the good institutions.